think I might have a uric acid stone. How do you know for sure?
That's a great question. And that brings us to the fascinating world of diagnosis. Doctors use all sorts of tools and techniques to figure out if those suspicions are right. It's like being a detective, piecing together all these clues.
Okay, I'm officially intrigued. Let's dive into this kidney stone detective work. Where do they even start?
Well, it usually begins with your medical history and a good old-fashioned physical exam. Your doctor will want to hear all about your symptoms, your family history, what you eat, your lifestyle habits, the whole picture.
So they're gathering all the intel before they even order any tests.
Precisely.
Makes sense. But speaking of tests, what kind of tests are we talking about?
Often they'll start with blood tests. They can tell us a lot about what's going on inside. For instance, they can measure your uric acid levels, which gives your doctor a peek into how well your body's processing this stuff. Elevated levels. That's a red flag that something might be off, and more investigation is needed.
So blood tests are like a sneak peek into what's happening behind the scenes. But what about the stones themselves? How do they actually see those hiding out in your urinary tract?
That's where imaging tests come in. They're like having X-ray vision.
Oh, cool.
Yeah. They help doctors see exactly where the stones are, how big they are, and sometimes even what they're made of.
Okay, this is where things get really high tech. What kind of imaging are we talking?
One common one is an ultrasound. It uses sound waves to create images of your kidneys, bladder, and ureters. It's pretty quick, painless, and really good at spotting those larger stones.
So an ultrasound is basically like sonar for your urinary tract. That's pretty neat. But what if they need to see things in more detail?
You got it. Then they might do a CT scan. It stands for computed tomography. It uses X-rays to create these super detailed cross-sectional images of your body so they can really get a good look at your kidneys and urinary tract. CT scans are especially helpful for finding those smaller stones that might have been missed on an ultrasound.
So they've got a whole toolkit to find those sneaky little stones. But once they find them, what happens next? What's the treatment like?
Well, that's a story for our next segment.